Hi, everyone. Welcome to the third episode of Maternal Minds. It's a series where I basically unpack postpartum OCD. And today's guest is Nora Pelot. She's a friend of mine. I know her from our OCD group. She's here to talk about her perinatal OCD symptoms and how that continued postpartum. Hi, Nora. Say hi.
Hi.
Do you want to introduce yourself a little bit and give me a background?
Let's see. I'm a mom. I'm a teacher. I got OCD. I think I had a few things when I was younger that in retrospect were probably OCD, but it first started affecting my life when I was in college, and I had relationship OCD, and then that lasted for a pretty long time. And then I had a few other, like I had POCD for a little while, also in college, and I had like the more stereotypical like checking OCD after college. But it got really bad when I was pregnant.
Mm-hmm.
I kept having all of these symptoms that are pretty normal, but then I would make the mistake of Googling them, and then I would find that could also be something really dangerous. And then I would go to the doctor, I'd get temporary reassurance, and I'd be back in the doctor's office like a week later with another symptom.
Yeah. So what were the pretty normal symptoms that you had?
Like feeling like I had to pee all the time. I was always afraid that meant I had a UTI.
Yeah.
So I got myself checked like multiple times to see if I had a UTI, and no, I just had to pee all the time because I was pregnant. I had some like pain in my chest, and I thought that meant that maybe I had preeclampsia, I think. I
don't know what the symptoms of preeclampsia are.
Yeah, you probably don't want to look.
I mean, I wouldn't. I'm surprised I don't have any really OCD during my pregnancy.
Okay. Yeah, that's interesting. I had the like when I was pregnant, it was really bad, and then after I had Zoe, I definitely still had OCD, but it was better.
So when you were checking and Googling symptoms, were you aware that your OCD had taken over at this point, or were you still thinking that it was just normal pregnancy anxiety?
I knew it was related to OCD because even before I got pregnant, I knew that when I got pregnant, it was going to attack my OCD. But I wasn't very knowledgeable about what to do about OCD yet. Like I knew I had it, and I had read a few books about it, but something about it just didn't quite click to the point where I really knew what to do about it and felt empowered that I'd actually be able to make a difference based on what I did. Does that make sense? So I definitely knew I knew it was OCD, but I didn't really know what to do about it.
Got it. So were you in therapy at this point or not?
Yes. So unfortunately, I think I saw 2 therapists when I was pregnant. For both of them, I was trying to get it through my insurance, which sort of limited my options. For both of the therapists, I mentioned in the preliminary conversation on the phone that I have OCD. I asked if they had experience with that, and of course they said sure. And so then when I started working with them, they were both pretty unhelpful. The first one she was probably a great therapist for certain things, but not for me. The second one was like just good enough that I kept seeing her for a while. But I think
she was therapy or like a CBT.
She would give me like relaxation ideas, but mainly she would provide reassurance and like talk. She would talk a lot and let me talk, but she wasn't really giving me that many things I could step away with and do.
Like no tools.
Yeah.
Yeah. Okay. And how pregnant were you at this point?
When I started seeing her?
Yeah.
Pretty pregnant, like 7 months, 6 months.
Okay. Well, your husband's also a therapist, right?
Yeah. Yeah.
So how was he supporting you or helping you during this time when you were pregnant and doing all your Googling?
So he's a therapist, and I think he's also more about how to be an OCD therapist now since I've gotten more engaged with my OCD recovery and have shared things with him.
Yeah.
At that point, I think he did a lot of giving me reassurance because he didn't quite realize that he wasn't supposed to. he got kind of annoyed with me at a few periods, but yeah, I think he did a lot of reassurance giving.
For sure. I think it's super hard to not give any reassurance because he's probably worried too at that point when you're pregnant.
He wasn't worried about my pregnancy at all.
So he was just letting you be worried and Googling everything?
No, he was worried about me and my mental health, but he wasn't worried about, like, he was never worried that I was having a healthy pregnancy. Because actually, in retrospect, I had a very easy pregnancy.
So after you were doing your checking, or while you were doing your checking and your OCD was attacking you during your pregnancy, was it only limited to like health related things?
During pregnancy, it really was. It was like the health of my baby. And then there was a few points where it was actually my own health. Like, I remember I was looking up, I think, the symptoms of preeclampsia because I saw these like floaters, you know, and then I became obsessed with floaters for a period of like a month. And at first I was afraid that meant that I had preeclampsia and I needed to go to the doctor. And then after that, I knew it wasn't that, but then I was afraid I had a brain tumor. And so it was the kind of thing. No. I mean, I talked to the eye doctor at one point and I said I had these floaters, and they didn't suggest that I go get a brain scan or whatever for a brain tumor. I think it's, and I don't think I needed to get checked for that. But I was like obsessed whenever I was outside about seeing all these floaters and convinced that I was going to die because of them. But a lot of it was symptoms about, or fears about me not catching something and then something going wrong with the pregnancy.
Got it. So you were compulsively Googling. Did you have any other compulsions? Like, did you go to the doctor a lot?
Yes. I went to the doctor, I'd say like twice or 3 times as much as I was supposed to. I feel like I was supposed to go like once a month.
Yeah.
And then I think I went like almost every week. There was a few times where I called with different symptoms, and because the doctors and the advice nurses are they try to be on the safe side, they sent me to labor and delivery. So I went to labor and delivery 3 times when I was not actually needing to. And I remember feeling really kind of ashamed about that, like that these people
were taking you?
What?
Did they recognize you, like any of the nurses or the people that checked
you? No, there's enough different people that work there that I don't think anyone recognized me. But I remember feeling really ashamed that like I was taking a bed and like space from people that really needed it just to check something out. But at the same time, like I really felt like, I don't know, I wasn't able to sit with the uncertainty of maybe something being wrong. So I felt like I needed to make the call.
Got it. It's understandable. Yeah. Okay, so you're towards the end of your pregnancy and you finally give birth. Then what happens?
Actually, so right after I gave birth, I feel like giving birth was such a crazy experience that it sort of took me out of my head, which was good. And then the first few days, I remember just being very happy. And I remember like having a lot of visitors in the hospital. I had something that I had been obsessed with before the birth, and I was sort of able to drop it a little bit.
What was that?
I went to an acupuncture clinic to try. So this is right before I gave birth. My obsession sort of switched from sort of general fears about pregnancy to contamination fears. So I went to this acupuncture clinic, and I think I walked barefoot across the floor. And then I saw a sign later that said, like, you're not supposed to walk barefoot across the floor. So then I became afraid that maybe I had stepped on a needle without realizing it, and maybe I had HIV and was going to give that to the baby. So that was what my... What?
They test you for that when you're pregnant.
No, but this was... and then before the incident with the acupuncture clinic happened.
Oh, okay.
So it wouldn't have been relevant or valid. So So that was my obsession before, and that was my obsession like right after having her too, was contamination. For at least like a good 6 months, I was afraid of different ways I could have contaminated myself because I was breastfeeding, or contaminated her because that was my fear, was giving her some sort of bloodborne pathogen.
Can you tell us any like specific compulsions that you were engaging in?
Yeah, so still a lot of Googling, a lot of reassurance seeking from like my husband and emailing doctors. At one point, I did get a blood test, even though it was like my doctor didn't recommend it. I was like, I could have done this. Could I have one? And the doctor's like, okay. But then that didn't work, because then when I was getting the blood test, I was afraid that I was getting recontaminated by like the way that they were giving the blood test.
Wow.
So
okay, have you done this before? Like, since you know that it's your OCD, have you ever alerted your practitioner or the people that you're calling and saying, so I have OCD, but this is my concern. I don't know if it's real or not.
I can't remember. I feel like I did tell my my doctor, or Zoe's doctor, at one point. I think I definitely did tell my my OB, and I'm trying to remember. I feel like she heard that, but she also like didn't understand what that meant. She's like, well, you might as well just ask me all the questions that you're having and let me give you answers.
Okay.
So,
yeah.
If I ever have this in the future, I'll try to do that better.
Because I've done that before, and I don't know if it has been helpful. Like, I did it once, and she kind of looked at me and like didn't know what to do with it. Maybe she just like looked a little bit more concerned. And then I did it recently with a new practitioner, and I don't know if it was the right thing to do, because now I feel like every time I say like a symptom or something, I'm like having to check his response by being like, well, is he responding that way because he knows I have OCD? Like, is he not taking me seriously now?
Yeah.
I just wanted to see if you had also done that.
I can't really remember. I feel like I did, but it was a long, I mean, it was a few years ago if I did. And yeah.
Okay. So how are you now?
A lot better. There's a few things that I did that really helped. So I made myself like a rewards chart where I could get prizes for myself if I do certain behaviors or don't do certain behaviors. So I get like a point if I spent a whole day and didn't ask for reassurance from anyone, or if I spent a whole day and like didn't Google. And just having like some sort of tangible thing made me actually do those things. And I noticed as soon as I stopped Googling and I stopped actually verbally reassurance seeking,
big one,
that my symptoms got a lot better. Like it would be like a day or two of feeling really crappy, like I was neglecting something, like I was putting Zoe's life at risk. But then after a few days, I'd start feeling better.
So verbal reassurance seeking and your like reward chart, did you come up with that yourself, or did your therapist help you?
I came up with it. So at that point, I wasn't seeing a therapist that was particularly good.
Okay. When did you start? When were you motivated to see your OCD specialist?
So that was when Zoe was like, I think somewhere between 6 and 9 months. I remember being at a point where I had done these things, like I'd stopped reassurance seeking a lot of the times verbally, but I would keep falling back into it. And I was considering taking medication, even though I didn't really want to, because I was breastfeeding, even though I know it can be okay to do that while breastfeeding.
Yeah.
But I just figured I ought to try everything I could before I tried medication. And so I decided to actually look up, like, okay, who do I actually need to be seeing for OCD? And then I found our therapist. And I feel like I got better, or like a decent amount better, pretty quickly after that.
How long do you think it took? Because people have a lot of questions about like, well, I started therapy, I've done 10 sessions, but I don't feel better, or I still have my obsessions. How did that go for you?
Yeah. I mean, I still have obsessions. I feel like I feel like it's recovery is sort of cyclical, right? Where you feel better and then like something happens and you get stressed, you get another content. It takes a little bit to recognize that that's also OCD. But I feel like I started seeing our therapist in maybe January, and I feel like I had some up and downs that spring, and I feel like by like April or May, I was like a decent amount better. Like not 100%. Like I definitely still had obsessions, but I feel like at that point my life was less like controlled by them, or in my mind I was less focused on managing my obsessions, and I was better able to focus on other things.
Yeah. So you mentioned the contamination obsession with the HIV and the needles. Did you have any others?
Yeah, I had. So I get cold sores, and I remember reading that if you give like if you kiss like a really little baby with a cold sore, then you get then it can be bad for them.
Yeah.
And so I had when Zoe was really little, I had this fear, even if I didn't have a cold sore, that like I might be about to get one, and like so I don't think I kissed her for the first like month or two. Like I nuzzled her, but I don't think I kissed her. And then one time I did get a cold sore, and then I was like freaking out for about a week because I was trying to make sure she didn't touch it and getting a little bit of cream.
Well, that must have been hard for you. I mean, I'm sure you kiss your baby.
What? Now I remember starting to kiss her and like being like, oh, this feels so nice.
I know. Well, because I just kiss on my babies all the time.
Yeah. No, now I do.
I'm sure.
No, now I kiss her like all the time. But I didn't for scared that like what if I gave her a cold sore and she died.
God.
I'm trying to think of what else. I mean, I eventually stopped being so much afraid of HIV and started being more afraid of hepatitis because I did a lot of research, which I shouldn't have, and figured out that HIV dies much quicker.
Hepatitis lasts for a long time on surfaces.
I know it does. But I feel like those were the main things. And then it's I think when I first met you, I was in my like lead phase.
Yeah.
Because Zoe actually tested positive for having like a little bit more lead than she was supposed to in her body. And so then that made me like search all of the things of the house, which the doctor actually told me to do for what would be giving her lead. But then I think I just took it a little too far, as I have a tendency to do.
So what helps you notice, like, how do you know when you're doing something that seems like normal, like checking your house for lead because the doctor suggests that you do? Like, how do you measure when you're doing it in a normal way versus when you're letting your OCD make all the decisions around it?
That's really hard. And that's probably what I'm still working on now, is like the gray area between like, this is something people would be concerned about. Like, how do I know when I'm taking it too far? I think one of the things is urgency. And that's what like my therapist will say. Like, if I feel like I know that maybe something is something I should deal with at some point, but if I'm like, I need to deal with this now, I need to figure this out now, and I will not feel okay until I figure it out. Like, I know that OCD, I think that's the main way.
I feel that too. Let's see. So would you say now that you're done with your lead obsessions and you're done with are you done with your lead obsession?
Pretty much. Well, for now.
For now, right? And you're done still with the needle thing? Because I know that was a big...
More or less. Yeah. I mean, now it's like...
No, keep going.
I'm just trying to think. Like, the needle thing turned into like a greater thing about blood. But I feel like I'm better about that now.
Okay. Do you have any obsessions or fears that you're still working on now currently?
Yeah. So I haven't met anyone else but this one. But right now it's like home safety. Not necessarily lead related, but like seismic safety, fire safety. What's that smell? Like, like there was a smell in my garage room that sort of smelled like it could be gas, and it would come off and on, and so like yeah, basically home safety has been a new thing. I also have a really hard time making decisions, like especially larger decisions. Like I live communally now, and whenever we get a new housemate, my OCD basically can draw like a straight path from like this new housemate and like Zoe dying. Like no matter what the housemate is, I'll find one thing about them. Like one person was had type 1 diabetes, just like my husband does. And so I was like, oh no, she could leave needles around and Zoe could poke herself with them, and she could get, if this person has a bloodborne pathogen, she could get the pathogen and she could die. So yeah, decision making is extra hard for me.
I bet.
Yeah.
Is your OCD freaking out a little bit during this coronavirus thing?
Weirdly, I'm not actually afraid of getting the coronavirus, which I was talking to my husband about this, and also I think my therapist. And I think even for us healthy adults, there's like, if we get it, there's like a 1% chance we could die. Sorry. I think maybe it's a 0.5%. I think it also depends on what kind of healthcare you can get. Anyway, there is a chance we could die. And I'm not afraid of it at all. And
That's so funny, because I thought for sure that you would be like freaked out.
I know. There's a lot of things that are way less likely that I could have died from that I've been way more afraid of. And
because like, what's the risk factors for seismic safety? Like, because I remember one time you told me that you were worried about the windows, right, in the house.
Oh yeah, like, I'm afraid of those windows.
Like, how come? Do you know what percentage that could happen?
I don't. I think it's very, very small. But here's what I think is the reason. I think part of it is because the coronavirus is legitimized. So it's like an actual thing that if other people are afraid of it too, I'm usually less afraid of it. So like if I were to
get in your fear or something, so you don't let it spiral?
Wait, say that again?
Is it because you feel validated in the fear so you don't let it spiral, or?
Maybe it's that I feel like other people are worrying about it too, and other people would catch it too. I feel like if I got the coronavirus, I'd go
no responsibility for you.
Doctor's hands. Exactly, it's not my responsibility.
Okay, now that makes a lot of sense, because with your daughter, it's like that whole hyper responsibility thing, right? You're the and you have to know. Oh yeah, it demonstrates the point that OCD defies logic. Totally, yes. OCD has the dumbest rules.
Exactly. So I've been I'm not that afraid of getting it. A lot of times also my OCD is focused on Zoe's safety, and so far kids have been not really badly affected by it. So I think that's another reason I'm not that afraid of it. The things that have been stressing me out about it are in part more responsibility related stuff, like is it ethical to send Zoe back to daycare if the daycare opens so that I can do work from home without Zoe, or should I be keeping her? Like little ethical things like that. Also, I think for everybody, it's putting a lot of stuff up in the air. Like for me, we're planning on moving in July. So I also have to be looking for a new job, and it might be harder to move. Like just having everything be up in the air and having to make decisions around like daycare, moving, and just not being able to know all the variables yet. Like that's been really stressful for me.
Yeah.
Yeah. My therapist says it's good practice, which is true. Just like sitting with the uncertainty of not knowing what's coming.
I know. She says that a lot. We have the same therapist.
It's true though.
I've been trying to use it as like practice, but for me, it's more of like an accidental exposure that's happening every day. It's not one that I'm going to be like, well, today I'm going to face the coronavirus. No, sorry. I just have to anyways, even if I don't want to.
Yeah. I don't know. I've been trying to meditate once a day and sit with my, like just feel how anxious I am feeling about all of the unknowns.
So now that you're having all this practice, is it making you feel any better about your like home safety worries?
I haven't been focused on them as much, and but I feel like overall, yeah, I feel like I do still have my home safety worries, and sometimes something will come up that'll make me freak out more. But I feel like it's not dictating my life really in the way that it used to.
Okay.
Yeah.
So I know that your husband is a therapist, but and you're already seeing a therapist, but who is your biggest support system throughout all this? Like not necessarily the pandemic, but just with having OCD.
I feel like my therapist has been really helpful. I really like you guys in the therapy group.
Oh yeah, I like it.
I feel like my house, I feel like they're okay. Like Jordan, even now, like he has a hard time not providing me reassurance.
Why is that? It's like they know the rules, but they can't do it.
Well, I think it's like almost a compulsion for him. It's like if I'm saying something illogical, he can't let it be there. He has to be like, well, that's illogical because of this and this and this. Like
my husband does it.
Can't let that sit. But yeah, it's nice. I mean, I feel like it's nice that my housemates know I have OCD. I haven't had as many symptoms that I've like shown them recently. But it's still nice knowing that they know and that we're all okay. And I don't know, I haven't really shared it with that many of my friends, which is something I've been meaning to do more.
How come you haven't?
I don't know. Like, it's like just awkward.
Yeah, like how do you bring it up? Hey, by the way.
Yeah. I don't know.
Do you think they would judge you, or do you think it would just be too hard to explain, or?
I think kind of both. I don't know.
Also, it's hard because it seems like one of those things that you would only have to tell someone if it was relevant to them. Like if somehow you knew it would help or hurt or something. You know what I mean?
Yeah. So I feel like, and I also feel like most of my best friends know. But it's not something that we talk about very often.
Yeah. Okay.
I really like the existence of like podcasts and other OCD stuff, because I think that's part of what has been helpful is just like hearing other people with OCD talk about their experiences and realizing like all of the similarities. Yeah, that's been really helpful.
Do you listen to OCD stories?
Yeah.
Duh. That one's really good. What about there's like that Panic podcast? Have you listened to that one?
I actually haven't listened to I haven't listened to any other podcast at length about OCD.
Okay. Do you have any favorite books for OCD treatment?
I do. There was it was by John Hirschfield. It's the Mindfulness OCD Workbook. I really like that one. And that's actually, I got that for myself back, like very at the end of my pregnancy. And it helped me like reframe some things in my head. Although I think I needed an actual therapist to get actually better. I'm trying to think. I feel like I read Grayson's book. I don't even remember what it's called. But
I think I'm looking at it right now. Freedom from Obsessive Compulsive Disorder.
Yeah. I feel like that was helpful.
Have you read Brain Lock?
You know, I think, is that one really old?
It's really old, and people have been telling me to read it, but I haven't yet.
Okay, I think I read it when I was in college, and I think I have a copy because I just found it because I was going through my mom's stuff, and I was like, oh, I should probably keep this.
I need to read it.
Yeah.
Okay, so what have you been doing lately to challenge your current obsessions?
I feel like I've been writing scripts, although sometimes for me, like I almost feel like the writing and then reading the scripts can almost turn into a compulsion. So I have to be a little careful with that.
Like if you do it right away or something?
Yeah, if I'm like, oh, I feel anxious about this, let me write it down. So then I turn it into a script. I feel like that can be a little bit compulsive.
Mm-hmm.
But yeah, I've been writing scripts and I've been reading them. I have been, I've been trying to meditate once a day and like really sit with my feelings of discomfort. I'm also trying to avoid, like, I'm trying to notice when OCD is playing a large part of my choices and trying to like step back and not let it make my choices for me. And I'm also working on, I've noticed myself more and more focusing, like my OCD has been sort of focused on logistical things recently about, daycare and like, do I pull Zoe out or do I stop paying for daycare and just have her not be there ever again because we're moving anyway, just like all these things. And I've noticed myself like wanting to start these conversations about them with my husband, even though nothing has changed. And I realized that's sort of like a compulsive desire for reassurance.
Mm-hmm.
So I've been trying to not have a conversation with him about those things unless there's something new that's relevant or something has changed.
Yeah, instead of just like talking about it just to talk about it again.
Yeah. The funny thing about the coronavirus though is like it's like things that you would normally do as an exposure, like you're told not to do. Like, go to the grocery store and like touch a bunch of extra things. Like that went from being like, oh, that's a great thing for someone with OCD to do with an exposure to like, that's like a big social faux pas. You don't do that. So.
Yeah, now I'm feeling like more validated, I guess, in being super wary of touching that. Because even before when I would go in the grocery store, I would just like cringe at how many people touched all the things. And if my son was trying to run around and touch it, I'd be like, no, please don't do that. And now that's like the thing to do.
But it's also hard. It's like, I feel like it's bad. If that was my thing for OCD, I feel like it is good for you to like I thought about that kind of thing too. And then I'm like, well, everyone touches everything and everyone's still okay. But now it's like, there's this virus and I don't know. It's weird.
Yeah, it's hard to keep the two together. I'm thinking like, what is it going to be like after, like when we're finally allowed to go outside? Like, how that's going to affect the people who like have contamination issues or basically anything. Like right now I get to be in a cocoon. I don't have to see anything. My biggest exposure right now is my husband coming home from work.
Yeah.
Other than that, I'm like, I'm cool. I don't have to touch anything. Everything's clean. Yeah. And they're like, you can leave your house on May 1st. Will
Maybe. We'll see. Oakland Unified just announced that they're closing for the rest of the school year.
Yeah, I think that's what would happen here too.
I'm not sure if the order is actually going to be lifted May 1st.
I mean, I don't think so either.
Yeah. But yeah, what will it be like when it is? I don't know.
Okay, so do you have any goals for the future for like your OCD treatment and recovery?
I think just continuing to find all of the ways in which I'm compulsing, kind of. Mm-hmm. So I think I do a lot of compulsions in my head, and it takes the form of reassuring myself. So trying to find the ways in which I'm reassuring, or the ways in which I'm like secretly compulsing and trying to get rid of those. Sort of related, I'm trying to work on being more present because I feel like I think a lot of the things I do to try to distract myself, like daydreaming about things, I think that might be sort of trying to avoid my feelings. So just trying to be like a more present human being, and also have my life like I know I feel like I've made a lot of choices that were not based on OCD per se, and I feel like I'm living a pretty full life. Well, I was before this lockdown situation.
Where you're trapped.
But just like living a life that is even less based on avoiding things that I'm afraid of, or based on like trying to somehow prepare for the worst.
Yeah.
Does that make sense?
I think so. I think that's what everyone's goal is. I mean, mine
Yeah.
and other people who have OCD. Less preparing, more living.
Yeah.
It's a hard one though. Okay.
Yeah.
So before we're like coming up on the end here, but do you have any advice for partners who are trying to support somebody throughout their pregnancy or postpartum who have OCD?
Yeah. You should,
or who maybe don't even know they have OCD.
Yeah. I would recommend starting with some like research, like read a book about how to support your partner with OCD. Like I know John Hirschfield has a good one. And I gave that one to my husband. What?
Did your husband read the book?
No, he read like the first half and then he's like, I know this already. I'm a therapist.
Yeah.
I
have the book. It looks.
No, I think he read. And then I think he might have read more. But I would really recommend doing that. And even if you are a therapist, like don't think that means that you know more than, or that you understand the situation. Like it's a very nuanced thing. I would also recommend, like my husband and I actually went for a few sessions, or at least one session with my therapist to talk about how to react to certain obsessions. So I'd recommend, doing some research. If you can, if you're a person seeing a therapist, like maybe have a session with a therapist so you guys can come up with a plan for how to respond.
Yeah.
And then the other thing is don't write everything off that the person has to say. Don't write off the person's every fear to being OCD.
That's such an important thing to say.
What?
I said that's such an important thing to say.
Because that gets a little annoying to the point where it's like I sometimes feel like I'm not allowed to have any fears because it's like, that's your OCD. And I'm like, no, people are afraid of things. It's normal. It's just the way that I react to it is not really helpful.
Yeah. Okay. Those are really good tips. If you could go back and tell yourself something if you could go back to Googling Nora, what would you tell yourself?
So like when I was pregnant, I would say that if you work on sitting with the uncertainty of feeling uncomfortable, that you will get better and that you will be able to enjoy yourself again.
Cool. Thank you.
Yeah, thank you.
Thank you for sharing your story with me and taking time out of your day. I know that you're probably busy with your daughter.
Yeah.
Okay. I'm going to let you leave the stream.
Okay.
Bye.
Bye.
Okay, guys, that was my friend Nora. We talked about perinatal OCD, how her obsessions are continuing now, and how this whole coronavirus has actually not been affecting her at all, really. Next week, I'm interviewing a mom from New York City. Her husband's a firefighter. She has 2 young children, and she is currently battling postpartum depression and postpartum OCD. So if you're interested in hearing about her experience and how she's managing her day-to-day life during this time, tune in next week, Thursday, 12 o'clock, the Made of Millions channel. Okay, thanks. Have a nice day.